If you're watching this video, you may have been prescribed Denosumab, brand name Prolia, as your osteoporosis medicine and be waiting for your injection. Or perhaps you're deciding if it's right for you. The idea of having an injection can be worrying for some people, but having Denosumab is an easy and straightforward procedure. Denosumab is an osteoporosis medicine. It makes your bones stronger and reduces your chance of breaking a bone. Bones are made up of living tissue. The inside of our bones is constantly being broken down and rebuilt by specialist bone cells. As long as this process is in balance, your bones should stay healthy and strong. But if the process becomes out of balance, our bodies can start to break down more bone tissue than we build. This can cause the bones to become weaker and more likely to break easily. Denosumab works by slowing down the cells that break down bone. This helps to restore balance and makes your bones stronger. Denosumab is given via an injection just under the skin, either in your thigh, abdomen, or upper arm. It's given through a tiny needle, like the one used for a COVID or flu vaccine. For most people, the injections are given in a hospital, but this is likely to be in the outpatients department and it doesn't take very long. Some GP practices have made a special arrangement to give injections after the first one. Our volunteer Kath has kindly given her time to share her experiences of Denosumab and explain the process, so you can get a feel for what happens.
I was diagnosed with osteoporosis in 2006. I fell over at the end of a walk in Cornwall. There was a loud crack and a fractured wrist was diagnosed. I didn't know much about osteoporosis then, so actually I wasn't really very concerned. I've used Denosumab since 2023, and my consultant recommended this after reviewing my DEXA scan, which showed little change. I always need to check that the Denosumab is actually in the surgery fridge, ready to use, because the practice nurse is just getting used to the setup. I previously used the hospital medical elective services, but it's been devolved to the local GP surgery, and basically I have to keep an eye that things are ready for use. When you arrive at the unit for your injection, you will usually be directed to the waiting area. A nurse will take your temperature to help stop infectious illness being brought into the procedure room or ward. You will then be brought into the procedure or ward room. You'll be invited to sit down with a nurse, and they will go through a pre-injection checklist with you, which helps to confirm that the treatment is safe to go ahead. You could use this time to ask any questions you might have or share any concerns. A nurse will prepare the injection in a different room, following strict hygiene and dosage requirements to make sure the injection is safe. You'll be asked whether you'd like the injection in your tummy, upper arm, or thigh. The injection is done with a small needle that is inserted just below your skin and takes only a few seconds. The needle is thin, and people often say they feel very little pain. If it's your first injection, afterwards you'll be asked to remain under observation for a short period just to check if you develop any side effects. Most people experience no reaction.
For most people, Denosumab doesn't cause any side effects, but you do need to discuss a plan for future treatment with your doctor. It's not easy to just stop taking Denosumab because it stops working very quickly. If you've been on it for a year or two, this can sometimes cause a spinal fracture if you aren't prescribed an alternative osteoporosis medicine to lock in the benefit. Talk to your healthcare professional about future plans, either to keep taking Denosumab long term or about a follow-on drug treatment should you need to stop. I would say it's definitely the best option I've had.
It's very easy to be administered, whether it's in the practice surgery or the hospital. There's no pain. So far I've had no side effects. It really is a very easy, simple and effective medication.